Welcome back to McLaren Port Huron's Today's Health Program. Today I'm speaking with psychiatrist Dr. Tom Brozovich about anxiety. Dr. Brozovich, how do you diagnose an anxiety disorder?
When I have someone come into the office describing anxiety symptoms, I always do a complete psychiatric evaluation, which includes extensive history taking. I think history is a large part of it, asking questions about what kind of symptoms do you experience. I also do a mental status exam where I observe the patient and ask them several questions. And I think the history is a large part of it. Sometimes also a family member will come in with the person who's experiencing the anxiety, which is very helpful because they often provide information in addition to what the person provides too.
So bring a family member with you if you can to help give you more information that maybe sometimes the patient isn't able to see in themselves.
Exactly, that can be very helpful. Sometimes the family member notices things that the person going through the anxiety doesn't even realize. Yeah.
Now there are several different types of anxiety disorders. Let's start with what is generalized anxiety disorder?
Generalized anxiety disorder, the hallmark of that is basically excessive worrying. So someone who is worrying a lot. It's normal for all of us to do some worrying. Everybody has some worries about some different things, but the person experiencing generalized anxiety is worrying excessively about many different things, and maybe many different things that other people are saying, oh, maybe just try to stop worrying, but it's hard for them to turn it off.
Now, worrying in some circumstances is, they say, helpful because it helps us to prepare for things like presentations, but I guess it's the point where it becomes unproductive, that it's not helpful to the person any longer.
Yeah, exactly. You're exactly right. I mean, to some degree, it can be helpful because it can help our alertness and it can help our arousal, so we're kind of ready and prepared. But also, persons with generalized anxiety disorder often find themselves to the degree where they're feeling fatigued, a lot of muscle tension. I have a lot of people who present with like a lot of shoulder and neck tension as part of their generalized anxiety disorder. Also, they can at times report feeling very irritable, so maybe they feel like things are just making them feel kind of agitated or irritable.
Now, what is panic disorder?
Panic disorder is characterized actually by a lot of physical symptoms, and we find often with panic disorder people describe what we call panic attacks, and those actually most often can occur out of the blue, not necessarily something triggering those. And they have a lot of symptoms like we described earlier, like maybe a choking sensation. People get a lot of the symptoms like rapid heartbeat, palpitations. Sometimes I have patients report that they feel chills, or actually the opposite, maybe hot flashes. They feel numbness or tingling sensation. And often people with panic will describe that they feel like an impending sense of doom, or something's going to happen.
Now, some of those symptoms that you describe with the palpitations or the choking feeling, I would think that it would be difficult for an individual to determine, is there something wrong with my heart, or is this anxiety? What do you recommend for people who are in that situation?
Yeah, it can be very difficult, and I'll have patients describe, I felt like I was having a heart attack actually. And we do find that many visits to the emergency room are related to people actually having a panic attack. So I do think when someone initially presents and they describe these symptoms, I always think it's very good to have also a cardiac workup to make sure that there's nothing cardiac or wrong with your heart. But often people will go through that and the cardiac workup is entirely negative, and that would lean more towards this is actually a panic attack.
Now, what about, we hear a lot in the news about post-traumatic stress disorder, in particular with veterans or those who have had sexual trauma or abuse. What is PTSD?
Yeah, PTSD, or post-traumatic stress disorder, it has up until very recently been classified as an anxiety disorder. It's recently been given its new classification under trauma-related disorders, but it's very relevant to talk about here. It's basically if someone has experienced a traumatic event and they develop these symptoms in relation to that traumatic event.
So are the symptoms the same as they would be for another anxiety disorder?
There are some similar features. One of the hallmark features of PTSD is that there is a re-experiencing of the traumatic event, either in flashbacks, which can occur during the day where the person feels like they are right back in that traumatic event, or it can happen more as nightmares at nighttime, where the person may find that they are waking up at night, they may be sweating, and they're having nightmares about the traumatic event.
Now, you hear a lot of people talk about my OCD. It's my OCD. What is OCD?
Right, OCD is otherwise known as obsessive compulsive disorder. Is characterized by those symptoms of obsessions and compulsions. Now, obsessions are basically unwanted, intrusive thoughts. So someone might be obsessing about like germs, cleanliness, or orderliness. For instance, they need things to be straightened or in the exact way that they want them. Or they obsess about germs, cleanliness, being dirty. Now the compulsions are the repetitive behaviors that are done, like excessive hand washing, maybe washing your hands over and over, or straightening things, or even some people, for their compulsion, will feel like they need to do like counting repetitively, like counting certain things.
Now, do phobias fall into the category of anxiety?
Yes, they do. Specific phobias are basically kind of irrational fears about specific things or objects. Like, for example, someone might have a phobia about flying, so they might avoid flying. They may decide, I can't get on the plane. Some other examples might be phobias about certain animals, maybe spiders. People have some fears and they do anything they can basically to avoid these situations.
Now, for others who are watching it, you see somebody who, for example, is afraid of spiders, and it almost seems like an over-exaggerated response, and others will think, well, why are you so afraid of that? But for the person experiencing that, they are unable to calm that anxiety related to that phobia.
Oh, exactly. It gets to the point where it's so intense. Like I said, they will choose not, like someone who has the fear of flying will choose not to travel. And you can see what an impact that may have on somebody's life. They may not be able to go certain places that they'd like to go to and experience that.
Now, what is social anxiety?
Social anxiety disorder is an anxiety disorder that's characterized by fear or anxiety about being actually in social situations. If in a social situation, someone with social anxiety may feel that others are maybe talking about them or scrutinizing them, they may also just feel like they want to avoid being in social settings. So again, with social anxiety disorder, we may find that people just choose not to go out. They'd maybe rather stay at home, or there may be specific social situations that they choose not to do. Also, another hallmark of social anxiety is that often people feel like they are going to embarrass themselves or do something that they think will be embarrassing, so they would prefer to avoid it.
Dr. Brozovich, this is great information. We need to take another break. We'll be back in a moment.